You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in the treatment of vein disease. And my first guest is an expert on the topic. We've had him on the show, has one of the busiest vein centers in America. And he says you don't have to have achy legs, tired legs, bulging varicose veins, restless legs anymore. In fact, insurance covers it. Medicare covers it, and he's here to talk about some of the new breakthroughs. So we have Dr. Hamilton. Welcome to the program.
Randy. Thank you. Appreciate it.
Now, you have a big center.
Yes.
And where are you located?
I do. I'm in Houston, Texas. We have several clinics around town, and our main office is in Sugar Land, Texas.
Great. What are the categories of vein patients that you see?
You know, there are a few different groups of patients. We see some that have the bulging veins. They may have burning, heaviness, achiness, tiredness.
So like the varicose veins?
Varicose veins.
Okay.
And then we have other patients that have no visible veins, but they have problems. Their legs are heavy, tired, achy, sore. They limit what they're doing. Then we have another category of patients that have really severe vein disease. And a lot of times they don't even know it's a vein problem, or their doctors don't know it's a vein problem.
Like discolored legs.
Absolutely.
You showed me these
yes,
photos.
These people's legs will turn brown, almost black color. Their feet can turn a purplish color. They may not have any bulging veins to say this is vein disease, but it's classic for venous insufficiency or vein disease.
Okay.
And if it goes on unchecked, it can turn into ulcers. We see people every day that have had ulcers for years.
But you see reversals and symptoms
Absolutely.
every day in your office?
Absolutely. Every day in our office.
What are the symptoms? Okay, so I say vein disease. I mean, what are somebody watching this?
Okay.
What are the symptoms?
Well, the symptoms are the most common ones: tired legs, heavy legs, achy legs. By the end of the day, people are just worn out. They're just beat. All they want to do is just sit down, prop up their feet, and rest.
But why is it a vein problem? And what's the connection
that's
making the legs tired?
Great question. So the veins. In these people, the veins stretch out, the valves don't work, the blood backs up in there, backs up all the way down the legs. The veins get stretched out and inflammation develops around the veins. And that is what causes tiredness, heaviness, achiness, soreness. And that inflammation, if it goes on long enough, can cause redness and itchiness in the skin. It can cause to breakdown in the skin, and it can cause ulcers. And
what about stripping, like stripping veins? Is that still an option in your hands?
Well, we do not do vein stripping, and there are still people that offer vein stripping.
Doctors, when you say people?
Yes, doctors are still offering vein stripping. However, there's much better treatment than that available now. So
is that done in a hospital, by the way?
That's done in the hospital.
Is it done every week?
It probably is, yes. Okay. And it's done under general anesthesia. The recovery is very unpleasant, very long. And then there's laser. Laser works well at closing the veins. And I used to do that, but it causes a lot of discomfort. It causes a lot of bruising, it's pretty unpleasant after it. It can be painful during the procedure.
Is it because you're heating the veins?
Yes, it's because you're heating the vein so much. You heat it up to about 800 to 1,000 degrees. It burns the vein really well, but it also gets the tissue around it. So the recovery is pretty unpleasant. So what I do is radiofrequency ablation or microwave. We heat the vein up just enough to burn the inside of the vein. And by doing that, it doesn't burn the tissue around the vein. The people do really well. There's just hardly any discomfort after this, but go right back to work.
Now, why isn't, because, look, I'm, anticipating this interview, did some research, but when I hear like laser, it sounds really advanced, because I know that you were doing a lot of laser last time.
It does.
But the next generation is
the next generation
or radiofrequency?
Is radiofrequency. So
is it trickier to do? Is that why everybody's not doing it that way?
A lot of people have less experience with radiofrequency ablation, and so they're not as comfortable with it.
Okay.
And so that's what we do. And the radiofrequency lets people go right back to work. There's just no downtime. People come in, they get treated, they go right back to work, exercise, kids, whatever they want to do. I mean, it's really a neat deal.
I told you in my green room, I said, my best interviews are when people just come on the show and tell me the truth, right? Yes. Everybody wants to be politically correct. Back to stripping for a moment.
Yes.
You don't like stripping.
I don't like stripping. I see
patients watching this.
Patients
what do
watching
they need to know about stripping?
They need to know that there is just not a good reason to do stripping right now. There are other treatments that are better. They're more effective.
But it works. Right?
Yes, it does work. Those veins that are causing a problem are pulled out, and it treats it. You're right, absolutely. Some of the problems are it's in the hospital, it's general anesthesia, long recovery really limits what people can do. Also, the recurrence rate is highest with vein stripping compared to any other treatment.
Okay.
And so I see people all the time who've had vein stripping years ago, decades ago, and now they have all kinds of new
But
problems.
can you do the same thing with these big ropey veins?
Yes. Actually,
in your office?
Yes, we can do the same thing.
So you don't have to do stripping?
We do not.
In your mind, it should be eliminated?
Yes, that's exactly right.
Interesting.
There's just no reason to do that now. There's just much better treatment for it.
And people don't know this?
People do not know this. People are not aware of it. Doctors aren't aware of this. This is kind of a newer field in medicine, and there's so much new stuff in medicine coming out that it's hard for people to keep up with everything, and I completely understand that. But this is something that's just so important and so common that I really want people to know that there's great new treatment for vein problems.
Now, how big of a problem is it, by the way? Vein problems, vein disease in Texas, do you know?
It's huge. There are estimates that 40 to 50% of people have some kind of a vein problem. Some of those are just going to be spider veins that don't really bother people. Others are people that have the bulging veins, and then you have people with dark skin and ulcers. And so it's a huge problem. People don't know about it because they don't see other people with this, because when people have vein problems, they wear socks, they wear long pants.
Good.
And so it's very easy for people to think that they're the only ones suffering with this. And I hear every single day people come in and they tell me, they go, well, you've probably never seen anything like this before. And I'm like, gosh, we've seen 10 people worse than this today. And they just don't believe it because they just don't see other people's legs.
You know, when we talked on the telephone and I was trying to get you to fly in for this interview, I wanted to talk about the big, bulgy, varicose veins, cosmetic in a way. And you said, Randy, really what I want to reach out to are the people that I could help the most.
Yes.
And you brought photos.
You're absolutely right. That's what everyone thinks of when they think of vein problems. They think of, the big bulging veins. It's a cosmetic issue. Veins are so much more than a cosmetic issue. The patients that have it the most severely are the ones that don't even have the bulging veins. I've got some photos here that
these are graphic photos.
I'd really like to show you.
Oh my goodness.
So this gentleman has, you'll see on the lower leg, darkening of the skin. There's kind of a dry skin around there from this itchy rash that people get. Spider veins.
So what are his symptoms? So he comes into you, what does he say?
So he comes in saying his legs are tired, heavy, sore. He can barely walk around now. This has gone on for him for years, and it's just gotten progressive.
5 years, 10 years?
Longer than that. And it's just gotten to the point now where at first he would, go to the store, he'd use a cart to walk around to put his weight on it, and then he kind of quit going to Home Depot, and then he just started not walking around the yard as much. Now it really hurts whenever he goes outside to get the newspaper, and he's really almost homebound because his legs hurt so much.
And what is he being told is the cause of this by his traditional doctors?
He's just being told that this is just what happens when you get older. He's in his young 70s, and he's in good shape other than this.
That's alarming, to look at that.
It's absolutely,
hard to believe that goes on.
It is. And this is such a treatable thing. And the neat thing about this is that I treated his brother. This is a very familial problem. His brother had almost the same exact thing, kept cutting back his activities, wouldn't go out, wouldn't do as much. We treated him. He did fantastic. Now he's able to go spend more time with his grandkids, walk the dogs around the block, be able to
and it's a vein problem. It's like the blood is backed up down there?
The blood is backed up, and it's a real issue. And just because it doesn't have big bulging veins all over the leg, it is a vein problem.
Okay, so when you see this, by the way.
Yes.
Okay.
Yes.
How soon from the moment the doc, walks in the door, how soon before you say, I can help you? How soon before you know this will work?
Oh, if these people are wearing shorts, I can see them across the room. I can see them.
Is it really always a vein problem?
When they have darkening of the skin around the ankles, if there are a few bulging veins, if they have an ulcer in the right location, it's almost always a vein problem.
So what do? You go in, you look at ultrasound, right? That's your specialty.
Right.
Ultrasound, you find what?
We find the veins. So what we do first, they come in to see us for a consultation. We talk to them, and I can, I can tell by looking at them within about 2 seconds.
Do you get excited sometimes, by the way?
I get really excited about this because
like when they're miserable, you're going, this is really good.
I know. It's almost the more miserable someone is and the more their legs hurt, the happier they are, and those are our best patients.
So you get somewhat excited during the
I get very excited with it. Okay. And then the patients get excited because they've been told it's a hopeless situation for so long that there's nothing to be done about it.
Do you really
That's
hear
the
that
way it
where
is.
they come in? I'm not trying to side with you. People need to know this is a real interview.
I see this every single day.
They say, I was told nothing could be done.
I've seen people don't like to live like this. This is not something they want. They're trying to get help. They go to doctor after doctor after doctor, and they are told there's nothing to do about it.
So you inject the area, or what do you do?
So what we do with this is, so they'll come in for a consult, we'll talk to them, and then we'll do an ultrasound. And then we do the ultrasound, we find out all the veins that are causing the problem. And then after that, we work with the insurance company or Medicare, whatever it is, to get it covered. And then we start the treatment, and we start treating it vein by vein. The veins that are causing the problems, we go after them.
You're collapsing them, burning them? What are you doing?
Yes, we're burning them basically. We heat the inside of the vein. The veins grow close together. We're rerouting the blood from the veins that don't work into the veins that do work. And so from the unhealthy, shallow veins into the healthy, deep veins, that's where the blood goes.
So when guys like this,
yes.
What's the after story on this guy?
He's so happy for giving him his life back. He is doing things now that he has not been able to do. I mean, honestly, such a big part of these people, they can't play with their grandchildren.
Because their legs are what,
their
heavy
legs
or
just hurt
sore?
So bad. And then
how soon do they go away, the pain?
The pain goes away very quickly, usually within a day or two. Usually a day or two.
Really?
Yes. I ask these people to go out and walk immediately after their procedures. Uniformly, they're like, that's great advice, doctor. I can't walk. That's why I'm here. My legs hurt so much. And I go, I completely understand. I want you to try it anyway. Almost always, they go out, they walk. They haven't been able to do that for years. And these people too, not only do they start walking as a part of the recovery after the procedure, they keep going and they keep walking. And we see folks 3 months, 6 months out, they're in a better mood. Their spirits.
Do they like to tell you their stories?
They love telling our stories.
Like when's the follow-up, and when do they tell you?
We see them a few days after treatment to do an ultrasound. And when we do that follow-up ultrasound, most of the time people are just beaming with how much better they feel, how much more they can do. People's dogs are some of the happiest beneficiaries out of this, because the dogs have not been walked forever. Within a week, people are walking their dogs 30 minutes at a time. They're doing it a few times a day, and they're so excited because they thought they would never be able to do that again. And they'd been trying to find out what the problem was. They'd seen people, and they're just like, there's nothing to do about it.
You're a bit of a perfectionist.
Yes.
I picked up on. Because on the phone we're talking about, you say, look, if people don't get pain relief,
right,
that you have a meeting with your staff.
Yes.
And I'm paraphrasing.
No,
but
you're absolutely right.
You said, look, if we can't, if they still have pain, we're going to get to the bottom of it.
That's exactly right. So when I really expect, when someone comes in and they have a story of vein problems, vein disease, an ultrasound that fits that, and we decide to treat them, I expect people to get a whole lot better, not just a little bit better. I mean, if they don't have dramatic improvement, we keep looking for something else. And I will tell you.
So you tell this to your staff?
I tell this to my staff. I tell this to the patients. And if they are not very much better, we keep looking, especially in patients with really advanced vein disease. And this is why we take care of so many of these people, is because it's really easy to treat the 1 or 2 big veins that you find and go, well, we've done all we can do. You've got to keep going. You keep going until you find it. And
who should they look for in a vein center? Obviously, you're on the program.
Sure.
They should go to you. But
right.
what do they need to ask of their vein center? What should they demand of their vein center?
Absolutely. The most important thing, wherever people go, make sure you have someone that has some real training in ultrasound. It's very easy for a physician to do a little bit of ultrasound training and get some type of credential
because
after their name.
Ultrasound is what finds the vein clogging or the problem?
Yes. Ultrasound is how you diagnose, how you find what veins don't work.
So they don't come back.
Exactly.
Okay.
What veins are causing the problem. And it may not always be the big obvious vein in the calf or the thigh. And you got to look for it. And the only way to do that is to really know what you're doing.
For the sake of time,
yes.
I know you brought photos.
Yes, I did.
So more of what,
okay.
What are we looking at there?
Let me just show you this one. So again, this This is a person that has darkening of the skin around the lower leg and ankle, so you'll see the brownish
But
color.
isn't that common? I mean, this is just part of aging?
That's what people are told, but it's not. This
Okay.
is a vein problem. The skin gets dark.
Like when you look at this,
Yes.
I mean, what am I looking at?
Okay, when you look at this, what you're saying, the dark areas of the skin are where blood's backed up there for so long that iron actually leaks out of the red blood cells. It stains the skin. The red areas are active inflammation in here. That can cause itching, which is very common. I see people every single day. They come in, they go, my legs have itched for years and years and years. And they've been to dermatologist after dermatologist. They've been given all these steroid creams. Nothing works.
So is that where they go oftentimes? Is dermatologists?
Yes. These
sent by the general practitioner to the dermatologist?
Sent by the general practitioner to the dermatologist because it looks like it's all in the skin. Yes, the skin itches, the skin's dark. The problem, though, is the veins underneath. And it's good news because this itching goes away so quickly. You treat the veins, the inflammation goes away, the itching stops.
Okay.
It's incredible.
But restless legs, like sleeping.
Yes.
Is this a person, like what symptoms would a person like this have? So they could identify
Very
themselves.
commonly, that's a great, restless legs will keep people awake all night long, people with leg cramps, especially at night. There's really good news for
Can't
that.
they just take potassium?
It's just, they're always told, eat a banana, drink some more water. It never works. It just doesn't work. Okay. The problem is the blood flow backs up in there and the muscles try to get this stuff out at night, and the way they do that is it cramps. And I've had so many patients that have not slept through the night in 20 years. Every night they're awake. They come in, we treat them, and within days, usually it's the night after treatment, the cramps are gone, the restless legs are gone. And they're like, I have not had a good night's sleep.
Are these the kind of people that tell all their friends?
Yes,
because I mean,
they are.
If you're in your 70s, which is very young.
Yes. Absolutely.
I mean, they're telling all of their friends, you got to see this guy.
Yes. I mean, these are people that are otherwise healthy. I mean, they're not, 70s now is young.
Yeah.
I mean, we see healthy 70-year-old patients
all day long. What about a 90-year-old? Do you ever see older?
Absolutely, we see 90-year-olds. And the great thing about this is even for the 90-year-olds, those are the patients that benefit the most out of this because they're the most disabled. They've got the worst problems from it. And we help them, and
so this is
amazing.
Covered by insurance.
Yes.
Okay. So ulcers.
Okay. Ulcers.
And we'll have to kind of jam through this.
Sure. Okay. No problem.
This is excellent.
So here you see the sore on the inside of the ankle. Sores on the inside of the ankle are uniformly from vein problems, even if there are no other bulging veins or anything like that.
My buddies, and I'm going to interrupt for a moment.
Yes.
A center in Orange County, California, that they treat these with salt wraps. They do different things. Type 2 diabetes, they tell them to eat better. Is that what's going on also in Texas? Where they're just told
absolutely
this is
yes.
a type 2 diabetes
They're
thing?
told it's a diabetes issue. They're told I've had 30-year-old people come in told it's a non-healing ulcer. They'll go to wound care centers, and they need the wound care. The wound care is good for these because sometimes they're infected.
So the positive message is they go to you, and what do you say?
We can fix this.
Really? You say that right there?
I tell them that, and we'll treat this. It's going to take some time to heal. Here's an after picture. These heal. They
don't come back in that particular area, usually?
They usually don't. The recurrence rate for venous ulcers after the veins have been treated drops tremendously.
So this was a vein problem.
That was a vein problem.
And why does it become an ulcer? I mean, give me the simple.
Sure. The inflammation develops. A lot of times it'll itch. There's not enough oxygen in the skin around there. It breaks down and it just can't heal. So until you fix that underlying problem and get better oxygen in the tissues,
so they go in on the consult with you. You have a free consultation.
I have a free consultation.
But you recommend, because it's cash or insurance. It's got to be one of the two.
Right.
So,
right.
Okay. So they go in and you actually tell them, you say, I could fix this.
Yes,
you
I
say
do.
That? Are they surprised to hear that?
They're very surprised. And one of the nice things about it is I'll tell them that, and then they'll routinely ask my staff if I'm serious and my staff sees these patients all day long, and they can tell them story after
they think
story
you're exaggerating
after story.
Sometimes.
They do. They tell
your staff.
Yeah, and
and
it's just amazing because they just don't understand. Let me just show you some more. I know we're running short here. So this purplish color foot, brown skin around the ankle. The purplish color is very common in these people, and it's because.
How old is somebody like this, by the way? Because this looks like a very old leg.
This person is in their 50s. However,
kidding me.
people look like that in their 30s. They also look like that in their 80s.
So with medicine, and I feel so rushed, this is a big topic, but when you start getting discolored legs, obviously early treatment is better. Right?
Absolutely.
But it's hard to get these people in, or no?
It's very hard to get people in for treatment, especially men that have this, because men
Put it off.
We don't like to go to the doctor. However, if people come in and see us before they start having symptoms, come in with the darkened skin, one, if they get treated, they're going to feel better.
So you want to reach out to, and we talked on the phone,
Yes.
when you come out here, you want to reach out to these people.
Absolutely.
Those brown legs, ulcered legs.
Yes. Those are the people.
Because the varicose veins ones are the easy ones.
Those are, yes.
According to you.
There are a lot of people around town that can
And
treat.
you'll do that too,
We
without
do.
stripping.
Yes, absolutely. Okay. We treat the bulging veins all the time in our office. The people that really do well with this are people with the symptoms in their legs, the discoloration in the skin.
And it doesn't hurt? The treatment doesn't hurt?
The worst part of this is the numbing medicine. And
Do
it's
they complain about pain?
No.
But in the old days,
in the old days,
or even currently with the lasers, you say it hurts.
Right. Even with the lasers, it still hurts. I have a lot of patients that had one leg treated with laser. It hurt so bad they did not go back to get the other leg treated, and they'll find out about us, and they come in and see us, and we treat the other leg. And I've got a lot of these patients. They all say the same thing.
So the take-home message, I want to make sure I get this right. Ask radio frequency.
Yes.
That's the next generation.
That is the best treatment.
That's the up-to-date way to
is.
get rid of veins.
That's
okay,
exactly
what else
right.
are we looking at? This is good.
Okay.
Thank you, by the way.
Oh, my pleasure. This was a great story. Okay.
And this is common, you're saying?
Yes. There are hundreds of thousands of people in Houston with this problem. They just cover it up with pants and socks so no one ever sees it.
Okay.
So this is a gentleman. He's in his late 80s. He's had this red, itchy rash probably for a decade. He saw me on a local show, said, "That's my leg," came in, saw us. I mean, it was amazing. We worked him up. We treated him within a couple of days. By the end of the week, all of the itching had gone away. His foot healed up. He was doing great. I mean, he's just, so many people are just sorry that they didn't know about us sooner and all that. But,
Can somebody be too far gone?
No. We've never seen anyone too far gone. Oh boy, I've got some pictures of some that have been told they were too far gone. Ulcers, toes, ankle. These ulcers heal up with good treatment. Another one, here's one. This patient had an ulcer.
It's a large person.
It's a large person, but that ulcer is not from them being large. And I see this all the time. People are told that they're just overweight.
Yeah, if you're 400 pounds.
You're 400 pounds, and that's why you have ulcers on your leg. And you know what?
Isn't that true?
It's not. It's not.
Interesting.
And a lot of times these are related. This ulcer's literally the size of a dinner plate. In 3 months, it was gone.
So even a 500, 600 pound person has these ankles.
Correct. Yes.
You go in, you treat the vein problem, and do they also feel better?
They feel better.
As far as lightness?
Exactly.
To their legs?
So many of these people, it's very hard to separate out, if they were really big and then their veins came or whatever. But what we find is we treat people's veins, their legs feel better, they're able to exercise. We routinely see people that come back and they've lost 30, 40 pounds, not really even trying, just able to get up, walk around. They're not stuck in their chair at home feeling bad. It's fantastic. I mean, here's another one. I mean, this is one that people would say, you are too far gone. You're just going to lose.
What was that person told?
In fact, he was just told he was going to lose his leg at some point.
Really?
They're like, just use it for now, but it's not going to stay.
He comes in on the consult.
Yes.
What do you say?
I say, we can help you with this. And we can get this ulcer to heal. There's no reason he should lose his foot. This is a treatable vein problem. And
so what happens?
And we can treat it. So we treat the veins, we treat it, get some wound care for that. The ulcer heals up, is able to walk around. I mean, he was limping into my office initially.
Do patients ever get frustrated where they say, I lived with this for so long, why didn't somebody tell me that?
Absolutely. Every single day.
They say that?
They tell me that. I've been trying to get help. People come in, they go, I need some information. I need your cards. I need some brochures. I need whatever you've got because I've got to go back to these doctors and I've got to show them what I had. And what should have been done to me a long time ago. And, a lot of them, I'm like, well, 15 years ago, there wasn't very good treatment. So that's why no one really knows about this right now. But now there is great treatment.
Good.
So I've got patients going out and telling people, and this is just another example of this wound was there for decades, literally. And we see people, you wouldn't believe it, that have sores on their legs for years. And they just never get treatment. They cover them up. They're embarrassed by them. They think they're the only ones with these.
So come in for a consult. I mean, that's your
Come
message.
in for a consult. Talk to us. We'll show you what's going on. And I think.
Do you ever have miracle stories where people that were absolutely couldn't even hardly walk, and then all of a sudden they're walking?
Oh, absolutely. I mean, and
like, what's your best one that even surprised you? I'll put you on the spot.
Honestly, I'm not even that surprised by these anymore, because we have so many people that the only thing they can do when they're at home is to sit in their chair and elevate their legs, because by the time they walk 30 feet, they're miserable. I mean, so now I've got people that couldn't walk, that there's a lady that came in and she had lived in this neighborhood for 30 years. She'd never gone more than a block from her house.
Okay.
We treated her. Within a week or two, she was out walking her dogs, exploring her neighborhood for the first time, literally in 30 years. And she's like, I had no idea what was 2 blocks away from my house, because
Very nice.
She just it just hurt too much. And now she's got a new life.
So there's an answer.
Absolutely.
So, I want to thank you for coming on the show. They should go to your website.
Okay. Thank you very
Always
much.
a pleasure to have you on the show, and thank you for coming back again. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again, or would like to direct a friend or a loved one to it, you could go to wellnesshour.com. You just put in veins, and you'll find, or of course, Dr. Hamilton, and you'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.